Good morning, good afternoon, and good evening, everyone, wherever in the world you may be joining us from today. My name is Francesco Del Carpio, and I am the CIFAL York Operations Coordinator. I would like to officially open the first session of the Nurses' Voices Speaker Series, which is being presented in partnership with the Nightingale Initiative for Global Health, or NIGH, with a land acknowledgement. We acknowledge and recognize that many Indigenous nations have long-standing relationships with the territory upon which our campuses are located that precede the establishment of York University. The area is known as Tekaronto and has been caretaken by the Anishinaabe Nation, the Haudenosaunee Confederacy, and the Huron-Wendat. It is now home to many First Nation, Inuit, and Métis communities. We acknowledge the current treaty holders, the Mississaugas of the Credit First Nation. The territory is subject to the Dish with One Spoon Wampum Belt Covenant, an agreement to peaceably share and care for the Great Lakes region. As this is an online event and our participants may be joining from various locations, I strongly encourage you to learn about the traditional land upon which you are located. With this, I welcome our moderators, our speakers, and our participants from around the world. Welcome to our webinar. For those who may not be familiar with CIFAL York, our center was established in 2020 and started operations in 2021. CIFAL York was created in collaboration between the United Nations Institute for Training and Research and York University with York Region to develop and deliver training and knowledge sharing, as well as capacity building programs across 5 focus areas, which are disaster risk, emergency management, and humanitarian actions, health development, environment and climate change, entrepreneurship, digital technology and economic development, equity, diversity and inclusion, and advancing the UN Sustainable Development Goals. Without further ado, it is my great pleasure to introduce our moderators, Dr. Deva-Marie Beck and Dr. Barbara Dossey from the Nightingale Initiative for Global Health. For the sake of time, their full bios and the bios of all of today's speakers will be posted in the chat. Dr. Beck and Dr. Dossey, thank you very much for moderating today's sessions and for all of the work you have put in to help put this series together. The floor is yours.
Thank you. Thank you so much, especially to the United Nations Training Institute and Dr. Ali Askari, Executive Director of UNITAR's York Center, especially to you, Francesco, and your collaboration has made this project a joy for us all the way already. Thank you also to each of you who are with us live. We understand that there's a large amount of people from 50 countries. And for those of you who will be watching this recording later, to our featured speakers and to our growing worldwide team of the Nightingale Initiative for Global Health, thank you all of us for being with us and in this session for the Nurses' Voices Speaker Series on this 2023 United Nations Day. Briefly about housekeeping, we have a very full schedule, so we will be presenting from now until our 1 o'clock for an hour, and then we will make questions and answers available for people from 12 to 12:15, from 1 to 1:15 our time. Why Nurses' Voices? I have 4 brief reasons. First, of course, the COVID pandemic has impacted all of us and changed our world as never before. Second, across the pandemic and in the months since, we have yet to hear our voices, the voices of 28 million nurses who have brought their courage, care, commitment, and compassion to our suffering despite their own suffering. We as nurses, and indeed as the whole world, are still suffering in problems that now seem intractable. Albert Einstein is quoted to have said that problems cannot be solved at the level in which they were created. Our Nurses' Voices Speaker Series reflects our ongoing aim to find new levels of solutions to the problems nurses face and to the problems everyone faces because nurses are at risk. Third, our namesake Florence Nightingale showed us the way. Across her nearly 50-year career, she demonstrated how to care for suffering during the Crimean War of her time. She took that knowledge and experience to build a nursing education program that is the foundation for nursing worldwide today. She also worked for 40 years to solve the problems of illness by keeping people from getting sick and injured in the first place. She urged her readers to consider an innovative solution to our problems, saying, "You must form public opinion. You must form public opinion." She was already anticipating nurses as thought influencers. Across the now 2-decade development of the Nightingale Initiative, we have sought to bring pilot projects to use well every power we have, just as Nightingale has suggested, now including NIGH's special consultative status with the United Nations, ECOSOC, and Social Council. Across nursing's history since Nightingale, and indeed across our COVID pandemic, nurses have based their practice, their service to humanity, on their attributes: courage, caring, commitment, and compassion for the suffering of others. These attributes are attributes our suffering world needs now. Hence, we have created this Nurses' Voices speaker series, aiming for a new level of solution for nurses to become trusted thought influencers, to discuss, to celebrate, to call for more of these attributes worldwide. And with these reflections, I am deeply grateful to be introducing my and our dear friend, Dr. Barbie Dossey, International Co-Director of the Nightingale Initiative for Global Health, who has been with me on NIGH's growing team ever since our beginnings in 1999. Barbie.
Thank you, Deva. It is truly an honor to be here with all of you today, and thank you for joining us. I have the honor of introducing our first speaker in the series, Dr. Pamela Cipriano, who is the president of the International Council of Nurses and professor in the School of Nursing and in the Batten School of Leadership and Public Policy at the University of Virginia. Pam, we look forward to hearing your words of wisdom. Thank you for joining us.
Thank you so much, Barbie and Deva-Marie and all of the sponsors of this presentation, this time together. It is really an honor to be part of this inaugural Grassroots to Global discussion today. And so I'm, again, very pleased to be able to bring some perspectives from the International Council of Nurses, because we know that this is a global dialogue that we're having. And there are no geographical boundaries to health or the threats to health. And it's really a critical time because we know that there is economic and political strife. We know we have global health challenges that we've never faced before, such as severe pandemics. We know there are threats from changes in the environment, and we are unfortunately experiencing more war and conflict around the world. And we know we've fallen behind in achieving the Sustainable Development Goals because of the pandemic. And all of these factors affect health, which is where all of us come in. Nurses are called upon to be our peacemakers, health makers, well-being preservers of nurses. And so we take on many roles. Now, while we're very aware of the problems, and I'm going to highlight a few, I also think that our time together and the insights that you will hear also bring hope. Hope for not just action, but hope for influence. And some of you may know that my watchword for my ICN presidency is the word influence, because I think that's a critical role for all nurses. Just a brief word about the International Council of Nurses. We have over 130 national nurses associations from around the world, all the different regions. We were the first non-governmental organization recognized by the WHO. So we advocate for not only the rights and healthy profession attributes, but also for healthcare for the people of the world. You certainly recognize the gentleman on the left side of the screen, Dr. Tedros, the DG of the World Health Organization, and he has repeatedly spoken out in behalf and support of nurses, saying that we are, in fact, the linchpin for not only the Sustainable Development Goals, but clearly achieving health. And one of the key targets now that you're going to be hearing more and more about is universal health coverage as the path to being able to have health security, as well as be able to support people in all of the SDGs. Now, as I mentioned, we can't ignore that we have been through some very serious challenges and are still emerging. So we don't want to forget what happened to nurses in the pandemic. We don't want to ignore the lessons learned. I'm part of the National Academy of Medicine in the United States, Action Collaborative on Clinician Wellbeing and Resilience. And one of the parts of this project several years ago was an art demonstration. And I thought this picture was especially poignant. It's actually by a medical student, and the submissions were from all over the country and all different professions. But it really does demonstrate the challenges of having this professional responsibility and need to perform, and the anguish and the fatigue and the fear and the erosion of our well-being that can occur, while at the same time we are members of our society and we have to think about taking care of ourselves. Now, again, we have so many things that we learned during the pandemic, and this is just a brief snapshot of where we are in terms of thinking about how we emerge and how we strengthen the resolve of nurses to deal with the issues before us. I don't have to tell you, mass traumatization of the nursing workforce has been problematic and continues to exert its effects. We see nurses leaving the profession, or at least making significant shifts in where they're willing to work. Education was disrupted and continues to be challenged in many of our countries. We also know that nurses were not always protected from COVID, either through delayed and non-prioritization of vaccination or not having the protective equipment from the very beginning. And we have seen the aftermath where nurses are reacting with industrial action all around the world, saying they will not continue to work, particularly in hospitals, with the conditions that we're facing. And that includes conditions that are putting patient safety at risk. One of the other key issues, and I know this is of concern to the Nightingale Initiative, is the mental health of nurses, and that we know that depression and anxiety have been pronounced and are not completely resolved. There's still stigma. There is still a concern that traumatic stress is part of what nurses are dealing with, trying to heal while they continue to work in many difficult circumstances. So our desire to be able to address the well-being of nurses is paramount in all of our work and concern, and it's central to the work of ICN and many of our national nursing associations around the world. There have been many surveys, and you've probably seen some of the results or participated in them. And so one of the more recent surveys, which occurred in April of 2021, so a year really into the pandemic, just reinforced all of the findings that we've seen. This was an international sample, with the majority, however, coming from North America and Europe. But the same issues are still here today: staffing, skill mix, workload, and the concern about leaving the workforce is very problematic. So this is our charge before us, not only to heal the workforce, but to feel or to find the words to be able to encourage nurses to stay and recruit new nurses. It's up to us to make sure that the dialogue remains positive and hopeful. Because mental health is such a central issue, it was striking that in 2022, we saw 3 major reports come forward on prioritizing mental health from the WHO, from the World Innovation Summit, and from ICN, as well as the Lancet Commission. So this issue is front and center. It is still a major challenge, both from the standpoint of an inadequate mental health workforce, as well as individuals not being willing to seek the help that they need. We also have a guidepost in the Global Strategic Directions for Nursing and Midwifery. Hopefully, you're familiar with these 4 areas of priority, which are education, jobs, leadership, and service delivery. And it calls for the investments and improvements in order to strengthen these workforces. And it came out right at the cusp of the pandemic starting, but is a blueprint for action now and into the next several years. The area called investment for service delivery is all about taking care of our workforce. And as you see on the quote here, how can we ask our people to give compassionate care when they're not cared for too? This is also referred to in the quadruple aim of better care experience, better outcomes, lower costs, and care for the care team. You may recognize this individual, who is Princess Muna Al-Hussein from Jordan, who's the spokesperson for much of nursing, mother of nursing in the Middle East. And she was a key speaker at WHA a year and a half ago, where she has been quoted routinely, saying applause without action is no longer acceptable. Recognition without rights and proper remuneration is not sufficient. So nurses no longer only want to have songs sung in their honor, being called heroes, or having the public applaud them. There has to be action. One of the key publications of the International Council of Nurses is Recover to Rebuild, which came out in the first quarter of 2023, analyzing over 100 studies that pointed to what it is we need to do now. What are the actions we need to take to strengthen the workforce, to be able to rebuild the workforce, and to recognize that without a robust workforce, particularly nursing, we cannot have health. Nurses are critical, and we believe this is a health emergency. So the report talks about the mental health effects of COVID. It talks about anxiety, stress, depression, and burnout, and the scale of mental health and trauma injury that is beyond scale of what we've seen in the past. There are many recommendations in the report to support and rebuild nursing and key aspects of investment. We have seen the call to governments that ICN is getting behind in order to say we cannot recover if we don't have vital investments. And an investment in the nursing workforce and an investment in health is an investment in the people, which means a stronger economy for our countries as well. So we have to be able to address all of the issues that relate to the working conditions that were present before the pandemic, as well as those that we've seen coming out of the pandemic. We don't want to continue to have the same conditions that devalued nurses, that did not hear their voices. So we are asking for impact assessments, supporting safe staffing, the protections, including vaccination for nurses, better education and education of more nurses so that workforces are self-sufficient in their countries, and there are opportunities for advancement. In a nutshell, there are 4 major areas for policy building: staffing, working conditions, including good pay, health and well-being interventions, and participation in the development and implementation to rebuild strong and resilient health systems. Now, I'm sure many of you are familiar with our code of ethics, and many countries have similar codes of ethics. But one of the statements that I think is particularly relevant to our discussion is nurses value their own dignity, well-being, and health. To achieve this requires positive practice environments characterized by professional recognition, education, reflection, support structures, adequate resourcing, sound management practices, and occupational health and safety. This means we have an obligation to take care of ourselves just as we do to our patients. And likewise, the work environment leaders need to make sure that it is a positive environment that supports nurses. Now, knowing as we came out of the pandemic that we had major work to do, the ICN put forward our International Nurses Day theme this year of Our Nurses, Our Future. And the key message that we sent is that we need to value, protect, respect, and invest in nurses for a sustainable future for nursing and healthcare. We issued the Charter for Change, and what I want to draw attention to is our explanatory statement here on the slide, because this is very consistent with the messaging from NIGH, which is we need to shift nurses from being invisible to invaluable. The voice of nurses must be heard. Nurses must be seen. So again, we sent the message, and this has been magnified and echoed throughout the world through our members and through others who have adopted this call to value, respect, protect, and invest in nurses. And I encourage you to go to the IND site, part of the ICN website, and look up the Charter for Change, 10 policy recommendations that starts with investment and really calls for worldwide action to make sure that we protect our nurses for the future. One last comment, because again, this is another fundamental belief of the work of NIGH, which is nurses really are peacemakers. And we have unfortunately been experiencing more and more humanitarian crises around the world. In 2022 alone, the estimates were that more than 300,000 people were now experiencing new humanitarian crises. We've seen this from natural as well as man-made disasters. We're very concerned with the huge threats to health from climate change. We know that the effects of war and aggression and any kind of conflict, any military action that is denying people access to food and safe housing and those kinds of things is putting many lives at risk. We know that refugee centers are not always able to keep people safe. So we have many conditions where nurses as peacemakers are trying to intervene and help those that we serve. So this is a really critical time for us to come together and to recognize that the well-being of nurses is fundamental as well for us to be able to care for the world. So I want to close just by thanking all of you that are listening in today, all of you that will be sharing messages, and all of you who will go out to your colleagues, and hopefully also soon speak to your country leaders, speak to your organization leaders to say nurses really deserve as well as demand investment in nursing, because their well-being is critical to the health of our countries and the health of our world. And by investing in nurses and investing in health, we strengthen our countries, we strengthen our people, we strengthen our economies. And I'll leave you with a nice little statement that I think if you haven't heard it yet, you'll want to repeat it to your friends. And this is again sort of the takeaway from investment. And it is that healthy children learn and healthy adults earn. All of our countries must embrace healthy children learn and healthy adults earn. And you, as our nurses of the world, play a critical role in making that happen. So thank you for all you do.
Oh, thank you, Pamela. Thank you, Pam Cipriano, ICN president. Your presentation is packed full of things to ponder, and thank goodness this is a recording so we can be watching it again and again. Thank you so much. Now it's my privilege to be introducing Professor Kathleen McCourt, the president of the Commonwealth Nurses and Midwives Federation, and a good friend. I have been privileged to be with the Commonwealth nurses across 5 of their conferences in London, and it's a privilege to be your friend and collaborator, Kathleen. Kathleen. Whoa. Kathleen.
Kathleen actually just sent me a message that their video froze. I see them reconnecting here though. I hope they're able to speak soon.
There she is.
Okay. Kathleen. Oh. Perhaps
speaker and then revert to her.
Yes, that's a good idea. Barbie, can we be introducing Lynn, and we'll have Kathleen after Lynn.
You want to do Gloria first?
Oh yes, Gloria first, please.
Yeah, I can get the
Francesca,
video set up.
Good
Yep.
idea.
Okay, great. Our next speaker today is Dr. Gloria Chan. She is the Vice President of Sigma Theta Tau International. She is unable to be here in person, but we have her recording, and we will now begin to hear that, and then I will come back.
I'm honored to be here and honored to always be involved with you and really get a chance to be part of this. So right now, I primarily practice full-time as a certified in Staten Island University Hospital specifically. It is a level 1 trauma center, so I do get a chance to practice in a wide variety of cases in all age populations. For me, that's been the most interesting part of my clinical career, which is to really be challenged and doing anything that I would like. Personally, it is to be autonomous, to have a lot of clinical autonomy, to really utilize my thinking skills more so than I would have anticipated. I think what drew me into nursing overall was really the chance to kind of flex your mind more than anything. I know most people really enjoy that humanistic side and that more of that psychosocial aspect of nursing. And I feel like personally, I've kind of done it backwards, where I was really drawn into nursing for the knowledge and for the ability to practice very highly. And then later on, I realized how important it really is to have that humanistic side, to really have those skills, those nursing skills that we develop. And that's what makes me a better practitioner and a better clinician more than anything. I have a lot of respect for our other medical doctor colleagues, but I think what makes us special is that we can integrate everything together and have that knowledge and those skills and integrate it seamlessly into that caring side as well, and really thinking of the patient as a whole and not just as a problem, and not just as, you know, 1 or 2 or 3 disease processes, but as a person who is dealing with all these issues. And how can I best integrate that fact this person is very challenging to handle, but at the same time they are a person who is dealing with these challenges themselves on an everyday level, and how do I bring those two together?
Now we see across the world a need for more caring, compassion, and concern for the suffering of people. Those are nursing attributes. What can you say about how nurses actually lead the way for what the world needs from our attributes?
I think a big part of it is that understanding of the suffering and what everyone is dealing with. One of my stances has always been that nurses are the ones dealing with every single issue. So whether it's a political issue, it's a social issue, nurses are the first people to handle it and to deal with it. We deal with all the consequences that happen. So we do have to have this awareness of what is going on in the world. It's not simply just a matter of what is healthcare, but is what is going on in the world itself. And I think nurses are really able to handle any kind of situation because we deal with that all the time. We already meld very seamlessly this understanding of knowledge, of medical knowledge, of nursing knowledge, and we blend that in with the psychosocial aspect, the emotional aspect. We are so well equipped to deal with that already. We just have to kind of think bigger, and I would say also think bolder. The fact that we deal with this every single day. We can certainly handle this. That's what's going on in the world right now. It's been such an honor to really continue to develop my specific own leadership skills as a UN Youth Rep for NIGH. I learned to develop this kind of understanding of like the global aspect of things, that it's not just what I do every day in the hospital by bedside, but to really think of the big picture. Within Sigma, I've been able to develop my own leadership skills with that understanding that it's more than just me, it's actually everybody else. And through my time being on the board of directors for Sigma, it's really thinking about even more than that. It's more than just me, myself. It's more than me in New York City, in New York State, in the United States. It's really thinking about what nurses on a global level really need and what they really need to have brought forth. That there is so much impact that nurses have, and also to kind of provide that voice for nursing on a global scale.
That brings us to the challenge that we have faced as nurses, as a world, the deeply, deeply challenging COVID pandemic and the burnout that nurses are feeling worldwide. Can you speak to that from your several perspectives, including as a teacher of nurses?
Certainly. I think as a person, it was very challenging. I worked in New York City at the time, so it was the epicenter for it for a little while. And I think I do have a very unique perspective that clinically, it was a very scary time. As someone who is also more experienced clinically, I've been practicing now for about 15 years, whether as a bedside nurse, ICU nurse, and now as a nurse anesthetist. I think it gave me that kind of emotional stability to understand what I was doing was very challenging, because it was hard seeing the death that was occurring. For me personally, as an anesthesia provider, it was also very challenging because on the one hand, at the beginning of COVID, it was, this is the only way to save someone. It's to intubate them and to provide them just a chance to breathe. And then later on, as more research came, it became intubation leads to almost a 70% mortality rate. And that was kind of very challenging for anesthesia providers and me personally to think I was causing something that was actually very detrimental. What I thought was helping was really not. And I certainly cannot take that kind of responsibility that I was harming someone. but it's also hard not to think that way. And certainly I always had the intention of I'm only trying to help them as best as I can. But that kind of thought is like very hard. But I at least had the emotional stability, the experience, the support nearby with me, with all my colleagues saying like, this is hard, but we know that we're doing the best that we can and we are trying our best. And that's all we can ever ask for. What I would say on the flip side is we had so many inexperienced nurses who did not have that stability, did not have that support, even that experience to say, whoa, I gave a medication and I'm not sure if I'm okay to think that might have killed them, that could have been the difference between them being alive and being dead. And I think that caused a huge detriment in the nursing field, especially for younger people, knowing that they had that kind of responsibility and they didn't have the time to develop that and understand that they were doing their best. They were trying as hard as they can. I think that definitely led to a huge burnout within the nursing field and the nursing profession. And I still think we're trying to recover from that.
Many people from across the world who are wondering now, well, do you have any advice for each of them around how they proceed with what they've experienced, likely working in COVID, but certainly being around the COVID situations? What would you say to nurses now to help with the recovery?
I would say for a lot of nurses is just to really have a lot of patience and grace for yourself. I think a lot of people have, tried to continue forward, and it was almost like a blip that happened for a while, and you're still kind of like figuring it out about how to react. And again, that's like my experience is I was able to kind of think it through. I had colleagues, we could talk it through, and I think I recovered pretty well from it. I think for some of our younger colleagues or more early career colleagues, you have to give yourself a lot of patience and understanding that some people still have like a lot of trauma from hearing a lot of alarms and they can't handle, like there's just too much noise. And like if something is happening acutely, there might be this kind of slight freezing up, that there's responsibility to be had. I think just giving yourself a lot of patience and understanding that it's okay to work through it. I certainly also would hope that our experienced colleagues just kind of give them the kind of grace and patience that they deserve as well to work through it on their own time. There's a lot of vibrancy within the nursing world. As someone who is growing up, sometimes I feel like there's a lot of good positivity that's necessary to propel us forward into the future. I think also is recognizing there's a lot of anger and negativity and what we consider almost more negative emotions, that there's a lot of frustration, there's a lot of anger, there's a lot of sadness involved with it too. But I would say we can hone all those emotions toward propelling the nursing field forward. There's a lot of positivity toward let's make the nursing profession better than what it is. And there's a lot of negativity towards, oh, the nursing is not moving fast enough for me. We need to move forward. Well, we can combine those two and make people get energized to do something about the nursing field. For everyone who's feeling so positive about nursing, we need you to help lead us there. We need your positivity to bring us forward. And for everyone who has this kind of anger and sadness about like nursing's never going to get anywhere, well, I would say, help me. I need your anger and I need your drive to propel us forward too. We need to bring everyone's voices together. We need to have everyone's ambition and drive to bring us forward, where nursing is very involved with everything that's going on in the world. Nurses can be the sounding voice for a lot of issues, but I also think nursing is very open-minded to understanding what everyone is going through. I think ask any nurse what kind of issues they hear. It's a huge multitude of issues. We deal with everything. We're kind of like the quintessential bartender when you're going out for a drink. We're that therapist that, you're having a tough time, you want to talk about it with someone. We are there. We understand what people are going through. And I would just say that very simply, nurses are here. Nurses will understand, and nurses are very willing to understand what anyone is going through. I think nurses are also very good at underestimating their capability. And we just sometimes need to say, like, we do so much. We both do so much. We can provide so much. We do a lot already. And just recognizing that talent is so important.
Exactly. And extending it, as you opened, extending it to the world and not just to our bedside assignments.
Correct. Thank you everyone for having me. I'm such an honor to be part of this. I wish I could have been there live, but I really appreciate just even having this chance to kind of discuss kind of some of my feelings on these topics. So thank you so much. I really appreciate it, and I hope I get to see anybody around, whether it's virtually or in person. Thank you.
Oh, that was great fun to listen to Gloria, and I for a while forgot that it was recorded. I think she did some really exciting things. I love how she started out in the beginning, nurses' capacities, nurses' capacities to
Francesco, there seems to be some problems.
And when she was talking about think bigger, think bolder. And I love there in her very final words there at the end when she says, share your vibrations. And that's one thing that happens with all of us. When we in nursing come together, we know what it's like where we really begin to sing, and then we tell the world what it is that we do and what we value and the work. So Deva, back to you.
Thank you, Barbie. And Kathleen, it's good to see your face. We're so grateful you're back on with us. And it is honor to be introducing you as a friend and a distinguished professor and nursing leader for Britain and for the world and for the Commonwealth Nurses and Midwives Federation, Kathleen.
Yeah. Thank you very much indeed. And I do apologise. We had a little bit of a technical blip there, but it was wonderful to hear my colleagues speaking earlier. And thank you, Deva-Marie, to you and everybody in your organisation for making this happen. I think particularly today on United Nations Day, very apt, very appropriate. So as you've heard, hello to everyone on the call. I'm Kath McCourt. I'm presently the president of the Commonwealth Nurses and Midwives Federation. And this is a federation of nursing and midwifery organisations that was established in 1973. So that gives us 5 decades of experience of working for and with many nursing organisations. The federation covers the Commonwealth, which is the East, Central and Southern Africa, the Atlantic, the Pacific, Asia and Europe. And we have a long history of support and activities for nurses and midwifery colleagues across the Commonwealth and working with the diaspora groups who are away from home. CNMF work together with a number of other health professional organisations and civil society groups, and we lobby and influence the Commonwealth health ministers. I think Pamela mentioned the World Health Assembly, and that's really the key place where we can target our Commonwealth health ministers at the assembly that's organised by WHO. As you've heard in the initial address and on the literature about this session, healthcare professionals have been severely affected across the world following the COVID pandemic, and many have not recovered. Recruitment, retention, these are all major concerns, and retaining the workforce and the funding costs are high on everyone's agenda. More critically important is how COVID has deeply affected the lives of nurses and midwives, their personal health, their families' well-being, the lives of colleagues, and their ability to deliver safe patient care, and also dealing with the trauma of the significant deaths of patients and colleagues. My hospital here in Newcastle upon Tyne took the first COVID patients in the UK, and we continued throughout the pandemic to receive patients during the whole of that period and throughout the recovery. But throughout the Commonwealth, we've now experienced the long-lasting effects of long COVID. All of these issues are having an influence on how nurses and midwives approach their work. They are exhausted, and their diminished willingness to work extra hours, to even leave the profession for less significant jobs, but with better working conditions. The acuity of patients is greater as waiting lists exceed anything that we've seen before. And people have tended not to seek medical advice during the pandemic, and therefore they're now more sick. The level of morale fluctuates among the profession, and at some occasions it's been at an all-time low. And this has affected the working environment as well as the educational opportunity for trainees and learners who are about to join the profession. Teams and departments are dwindling and expertise is being lost. Often colleagues are deciding to retire early, leaving huge knowledge gaps in organisations and countries. And we see this particularly in the role of nurse teachers. However, many Commonwealth countries have experienced years of serious infections, malaria, dengue fever, Ebola, SARS, not to mention the childhood illnesses and how the lack of vaccination is seeing major diseases such as tuberculosis flourish and return to significant levels. Migration and movement of workers is another issue, as we've seen nurses in some countries are unemployed, even though there is a great need for them in their health service. We know that nurses and midwives continue to be the first port of call in healthcare in all communities across the globe. The demographics relating to health and well-being are stark, with nutrition, hydration, sanitation continually causing major concerns. This is also disrupting the work of the non-communicable diseases. CNMF continues to support universal health coverage for all and lobbies for this on all occasions. However, the economic inequalities and limited interventions see low and middle income countries continuing to struggle, while high income countries are suffering the diseases of wealth. I too am very similar to CNMF. I personally have 5 decades of nursing and midwifery practice and education in hospitals in the UK, Germany, the USA, and overseas in Malaysia, China, and Egypt, and now as a non-exec director in a huge trust with over 17,000 staff. And my Commonwealth work, every day I recognise that nurses and midwives bring a unique perspective to the care of patients and communities. These deliberations need to be shared with the Commonwealth Health Ministers, and it is through the work of the National Nurses Associations in country, and that collective voice needs to be heard loud. But it not only needs to be heard, but it must be listened to and understood and acted upon. As I work with my Commonwealth board members and my colleagues, it always amazes me that the extensive role of a nurse or a midwife continues to contain so many aspects. They're caregivers, infection control specialists, trainers, educators, economists, workforce analysts, leaders, managers, and this is at every level, not just at recognised level of leaders and managers. CNMF know the contribution and the resilience that every individual practitioner has to make in their healthcare system, in their country and beyond. Speak to any nurse or midwife and they will tell you of their influence on their communities. Throughout my career, I've worked with brave and courageous men and women, and they have developed skills and confidence and resilience as professionals and leaders through very difficult and challenging times. Commonwealth nurses and midwives have developed their roles against a background of political upheaval, economic variations, and the struggle for equality and recognition. We see distinctive qualities across the globe, which allows the refinement and the expansion of the nurse's function and responsibility. Modern nursing and midwifery demands a powerful force in healthcare. We must have better working conditions. Pamela said this earlier, greater flexibility, degree-level education, improved scope of practice and enhanced professional recognition. We need to recognise what we have as legacy and continue to progress. If I could turn to nurse education now, we must maintain the strides we've made for degree-level education. The workforce can be made up of many roles and levels of responsibility, but the registered nurse is and should always remain the prescriber of care and be as well educated as possible to do that. They must be equal around the tables, the multidisciplinary meetings and the management hierarchy, and their voice to be equal and listened to by all. In fact, we know that the others couldn't do their job without nurses and midwives. However, our education system and curriculum must be current and relevant, with significant aspects of demographic disease patterns, data analysis skills, and digital innovation and creativity. The pandemic saw the increase in digital working, patient consultations, reducing the need for patients to attend hospital, use of technology and diagnostics and screening, keeping patients at home with devices and monitoring. All of these are possible and can be achieved, but our nurses and midwives cannot be left behind or passed over in these initiatives. They, together with patient voices, are essential for safe patient care. The nurse and the midwife are key navigators and advocates for clients. This co-production is essential. Equal levels of physical and mental health issues are to be recognised and included, ensuring the well-being and holistic care is offered to all. We need to provide placements with high-quality supervision and safe environments for learners. Learners bring a huge benefit to clinical areas, and their questions and energies, searching for answers and understanding, are essential. I hope you remember your role models and how influential they were for you. I know I do, and I aspired to be like them, but I also knew the ones that I did not aspire to be. Our young people are also very aware of the need for sustainability, the effects of climate change on our populations, and their input into the needs in future planning and practice are essential. We all have a responsibility to encourage our next generations and help them to be proud of the profession and contribute to the future. As employers, we must maintain support for CPD and provide opportunities for enhanced scope of practice and academic advancement. Evidence and research are essential, and they need to be continually integrated into our work and practice. During a recent visit to Assam in India, where the Trained Nurses Association have been working hard on their learning resources, I also heard how they'd been looking after their members during the pandemic. Large numbers of their members had been in need of the support as they had been severely affected and suffered great loss during the pandemic. There have been many examples across the Commonwealth of assistance with financial planning, food fridges for staff so that at the end of a shift they can take food home, psychological support for our intensive care staff, the provision of effective PPE and vaccination programs. Many nurses and midwives did not go home during the peak times of the pandemic, so attempting to keep their own families safe. Post-pandemic, some organisations have offered sabbaticals or extended holiday time to help rejuvenate staff who were on the front line. So we need to re-energise our profession and particularly encourage our keen learners to stay and stretch them to aspire to be safe practitioners and perhaps to progress to be professors of nursing, future Florence Nightingales, because the profession needs them. We all need them. I also want to say that I think we should be kind to each other. And that sometimes is an issue for nurses. We can be kind to lots of other people, but often forget ourselves. So please think of your colleagues, give them support, advice, listen attentively to their moans and groans, give them strength and kindness. And I'm very proud to be a nurse and a midwife. And thank you to all of you today for listening to me. And I want to recognise the great work you all do. Thank you.
Thank you.
Oh, Kathleen, thank you so much for your wonderful words. And you really spoke about this we space, what we can accomplish when we honor each other, when we find our mentors, and we can increase our voice in healthcare policy, in education, and in health, and really addressing body, mind, spirit, culture, environment. Thank you so much.
Thank you.
Now let me introduce Lynn Chase, who is one of our NIGH board members. So Lynn, to you now. Unplug.
I'm honored to be with all of you today, and I speak to you from the clinical setting. And I choose to remain in the clinical setting because I'm close to the patients. And that's exactly why I went into nursing over 30 years ago. It's my first love, and I still love being there and taking care of the patients. And I also am close to my nursing colleagues, and it gives me the opportunity to understand the challenges that we are facing in our nursing profession day to day. But over the past few years, I've become increasingly concerned, as all of you have, about our profession. I see the newly entered nurses leaving within a year or two, and I see experienced nurses leaving long before they should be retiring. I see organizations rolling out all types of recruitment and retention initiatives, but yet it really is not making a difference in terms of the recruitment and retention. There hasn't been much success. So I'm trying to understand, what are we trying to fix? Perhaps we need more structured improvements within our profession. Some of this has already been mentioned. In leadership programs, nurses should be educated as well as mentored and exposed to nurse residency programs in leadership so that they can experience high quality leadership and mentor that. Nurses should be also exposed to outside the clinical environment and participate actively in areas such as health policy so that we drive health policy rather than being recipients of health policy. Also, resource leveling is important. This has also been mentioned, so that nurses' skills, expertise, and knowledge are used wisely. And this in turn relieves frustration so that their talents and that are maximized. We should think about restructuring our nurse education programs. Currently, we turn away so many students because we don't have enough nursing professors and instructors. I think we should rethink the qualifications to teach. Maybe we could incorporate our experienced nurses somehow in this process, whether or not they have a PhD or a master's. Certainly they have something to contribute to teaching new students, thereby allowing more students in the educational system and graduating more students into our nursing profession. This may lessen the burden for some professors, but the question remains, are any of these initiatives really going to make a difference? And how do we know that these are the right priorities for nurses, especially at the local level? And this is where my focus of interest is. My colleagues tell me that they're not being heard, no one listens, and that they're not able to care for the patients the way they thought they were going to be able to care for them when they entered the nursing profession. And this leaves a mismatch of expectations, and therefore they suffer a fairly significant degree of moral distress. And as a result, they leave. But I think we can do more to support our nurses at the local level, listen to them and understand and hear their voices. And one way we need to do this is by gathering more data, qualitative and quantitative data, and push this upstream to create policies to support the nurses and allocate the resources in terms of programs that are developed appropriately. My hope is by focusing on nurses in this way, we can heal ourselves and our beautiful profession.
Lynn, thank you so much. Can you hear me now?
Yes.
Yes. Thank you so much, Lynn. It's a wonderful thing within our Nightingale Initiative board. We have Lynn at the Grassroots, still in clinical, literally here on your lunch hour from your 12-hour shift today. And then to go back to the global with our distinguished NIGH board member, Mr. Cyril Ritchie, who is our UN representative in Geneva and who is our advisor with all of the things that we're doing to make a difference at the global level as well. Cyril, it's a privilege to hear you now.
Thank you very much, Deva. As you say, I'm in Geneva, that's where I live, but I'm speaking to you from my hotel bedroom in New York on United Nations Day. I've already been on the UN premises this morning, and I wish everyone a happy UN Day. As you probably know, the NIGH has consultative status with the United Nations through the Economic and Social Council, and it is also an esteemed member of the Conference of NGOs in Consultative Relationship with the United Nations, whose very short name is Congo, which is why you see that on the screen with me. I'm a former president of Congo and currently the first vice president. The purpose of NIGH and all NGOs' consultative relationship with the UN is to input documents and to input opinions to the UN at conferences, through the Secretariat, and other ways. There's quite an extraordinary variety of non-governmental civil society organizations that have this consultative status. Many of them are operational, many of them are advocacy focused, and many, of course, do both. They relate to all parts of the UN system and to the government delegations, since the governments are the actual decision makers. Although, as I often had to say, they don't sufficiently implement the decisions that they make. They don't implement the conventions that they agree to in any full way. So we also have a role to influence very directly governments to make the right decisions and to follow them up. Many of the NGOs with the consultative status are professional associations and groupings, and they include several with a nursing basis. And NIGH will certainly be welcomed by all these partners to augment this role of nurses at every level. Because, as I understand it well, not being a nurse myself, we have to be sure that we can have the input of nurses, of their concerns, their hopes, their aspirations, their needs, their issues. And of course, they all have, as we all as individuals and other actors do, a role in implementing the Sustainable Development Goals, on which we have a very long way to go. So this Nurses' Voices speaker series will be a major contribution to that input to the United Nations system from nurses worldwide. And I wish it all success and a future growth, and particularly in having nurses' voices heard on all the vital issues that were so well described by Pamela Cipriano. Nurses are indeed health makers and peacemakers. Thank you.
Oh, Cyril, thank you so much for your wise words. We have been in partnership with Cyril ever since we began 20 years ago. And one of the things that I will say is, when you can find a partnership and you come together in this we space, it just blossoms beyond measurements. I would also like to say that there are 3 other board members. I don't know if they are with us today. Dr. Tess Panasalis, she will be the moderator for session 4. And Dr. Falakshi Manjrekar will be the moderator for our session 5. And then Dr. Ilya Kagan will be our moderator for session 7. So if y'all are on by chance, you might be able to come on. And Deva, I'm going to turn it back to you.
Yeah.
There's Tess. Hi.
Yes, Tess. There's Tess. Hi, Tess. Thank you. Well, yes, we're running a little bit over. So I'm going to close with the remarks that I've prepared for the ending. Barbie, thank you so much. Thank you so much to everyone. I'm going to share my screen now with a brief introduction to the Nightingale Declaration for a Healthy World. Nightingale Declaration for a Healthy World. I'm going to be reading it to you, and perhaps you feel like reading it with me. We, the nurses and concerned citizens of the global community, hereby dedicate ourselves to achieve a healthy world. We declare our willingness to unite in programs of action, to share information and solutions, and to improve health conditions for all humanity, locally, nationally, and globally. We further resolve to adopt personal practices and to implement public policies in our communities and nations, making this goal achievable and inevitable, beginning today in our own lives, in the life of our nations, and in the world at large. Florence Nightingale, what would have she said to us? We are only on the threshold of nursing in the future which I shall not see, for I am old. May a better way be opened. May we hope that when we are dead and gone, leaders will all arise who have been personally experienced in the hard and joyful work, the difficulties and joys of organizing nursing reforms, and who have led far beyond anything we have done. Please join us with your voice at the Nightingale Declaration for a Healthy World webpage, www.nighvision.net/declaration.html. Again, nighvision.net/declaration.html. And please remember that on November 28th at 12 noon Eastern, we will have our next session, Nurses' Voices from the Western Hemisphere. Please save the date. And now, Francesco, I think we can go to the questions, and thank you to everyone who are patiently waiting now to have some questions answered.
And Falakshi.
Oh, good. Falakshi.
Yeah, thank you. I don't think Ilya was able to join us today, unfortunately. But yes, Tess and Falakshi are here. There is one question here. Well, there's been many messages of thanks for the series and of praise for the presentations. There is one question that I see here, though, from Kathleen Aviza. It says, "Hi, thank you for the panelists and for putting together this webinar. My question is regarding peace and security and global health. The posture of the nursing and the healthcare profession in general has been focused on curative, recovery, and post-conflict efforts. I'm wondering if it's high time for the healthcare field to take a stand in terms of prevention of wars and man-made disasters and be more proactive in peace measures, especially after pandemic in Ukraine and now Palestine and Israel."
Wow. Perhaps Pamela and Kathleen, would you like to speak to that question?
Sure, I would be happy to, and say hi to my friend Kat. Great question, and I can assure you that there is proactive work being done, particularly when we think about the effects of climate. There are lots of affiliations and work together with a number of groups, including the United Nations and WHO. So that work actually has very extensive collaboration to look at mitigating and addressing those kinds of effects. And so we're not waiting, we're actively addressing. I mean, I just actually recorded something this morning for the COP28 meeting. So there are places where nursing is making its voice heard. Similarly, there are nursing associations working in this area. The peace process is obviously one that is front and center for all of us right now. And it's hard for us to get upstream from that, but I can assure you that when there is the first notice of any kind of conflict or aggression or all-out war, the International Council of Nurses is immediately in touch with the associations in those countries for two reasons. One is we want to be able to find out if there are things we can do to help. And two is we are also communicating to those countries' leaders, whether it's about a ceasefire, whether it's about protecting human rights, whether it is about recognizing, again, that that the rights of individuals to receive health care during that kind of conflict must be sacred and must be respected. So there is active political as well as diplomatic, if you will, even within the nursing channels, work that is going on for all of these measures.
Oh, thank you. Kathleen, would you like to speak to the question as well?
Yeah, I mean, I think in the national nurses associations in country in the Commonwealth, there are often the military nurses are included in those groupings. So that is a direct route in from Commonwealth perspective. But also, I think looking at the man-made disasters, there's a very active stream of work within the Commonwealth around climate change and sustainability and the effects that the climate and this is the major issues have on our populations, particularly in the South Pacific, etc. So these are things that both civil society and the nursing and medical Commonwealth groups are working with to ensure that the voice of healthcare professionals are heard throughout.
Well, thank you, Kathleen. Francesco, who do we have next?
Actually, I see Cyril has their hand up.
Good.
I think
Yes,
they might want to
please.
weigh in. And then we could go to the next question.
Of course, Cyril.
I'd just like to say one additional word on this. The number of wars and conflicts in the world is just appalling, in addition to the ones cited. There are civil wars in Yemen, Democratic Republic of the Congo, Sudan, and all of them as bad as the appalling Russian aggression against Ukraine. So in all of these, it's the citizens who have to stand up together to demand peace, to demand that governments respect their international commitments, their commitments under the United Nations Charter. And it's only if we all stand up together, stand up and speak up, that we can hope to have an influence on warmongers everywhere. And nurses will be a wonderful example of people responding to that need. Thank you.
Thank you, Cyril. Francesco, who shall we have next?
So we have another question here from Luktirka Combat. Their question is, well, they start off with thanks. So they say, thank you very much for providing an opportunity and forum for the voices of nurses to be heard. We are the building blocks when it comes to healthcare and arguably forms the most important personnel in the health system because we're able to integrate the inputs of other professionals in the healthcare setting to achieve our holistic goals. Nurses' voices must be heard. Thank you. So I'm so sorry. That was more of a comment, but it was a very good comment to add to the conversation. So thank you for that. Here we do have a question from Alana Cueto. It says, thank you all for this wonderful presentation. My question is, what recommendations would you give an American from the United States of America, registered nurse, that's interested in expanding her role in global work, living and working abroad? Thank you for your guidance and support. Again, they just signed off from Alana Cueto, who is an MSN, RN, and CNL.
Thank you. Barbie, would you like to answer that question? No? No, Pam.
So this is always a challenging question. There are a variety of ways to become involved, both probably more informally than formally, because right now it is the National Nurses Associations that have the primary connections to global work, and our universities, particularly those that have WHO collaborating centers. So I think there's several places to look for those connections. Now, there's what is your National Nursing Association doing? The American Nurses Association does have official relationships with us, and then also, again, there are more than a dozen schools in the Americas that are collaborating centers. So you might want to take a look at what they're focused on. Now, the other place that, again, sort of informal, depending on the kind of work, there are many volunteer activities. So there are humanitarian groups, there are NGOs, non-governmental organizations that would love to have nurses helping. And that starts with the International Red Cross and Doctors Without Borders, which actually has a big nursing section, and also looking at where the intersection is. Maybe you have a specific ethnic group that you want to connect with in another country. And it's trying to find those connections on the ground where you can say, I would like to be involved And again, look for colleagues who are also already doing global work. They are probably the best source of putting you in touch with someone where you can work with them, and follow the work of WHO, follow the work of the UN.
Well, thank you, Pam. And I'm realizing that you may actually wish to be involved with us if you're interested in this idea of bringing nurses' voices to the world. If you're interested in that, contact me. I'm at very easily Deva-Marie at earthlink.net. Get back to me saying that you asked that question, and we'll get you involved in our project, Nurses' Voices. Francesco, any other questions?
Yep, we have a couple more here. We have the next one from Swati Rani. I hope I'm pronouncing that right. Apologies if I'm not, but their question is ICN planning to help LMIC countries or lower middle income countries nurses for developing some advocacy courses and movements for better working conditions and better pay? This question comes from a nurse in from Dr. Swati in India.
Wow. Pam.
So thank you for the question. And we actually are doing a fair amount of work. You heard me mention the Charter for Change. That is 10 policy recommendations that our nursing association members are able to use in their conversations with country leaders. So we're very careful to say this is not just a conversation with the Minister of Health. This is a conversation with the President or Prime Minister and the Minister of Finance and the Minister of Education. And so individuals in nursing leadership roles that already have experience addressing policy issues, we want them to take action. Now, you asked about advocacy courses. So the most important work that we're doing does flow from our established leadership courses. We have had many courses called Leadership for Change that have been implemented around the world. There are a number in the area, particularly in the Asian area, but also we've been able to have some individuals from Latin America join some of those courses. And right now we are bringing together a project for the African continent with over 22 of our nurses associations, where we are providing that leadership development. In addition to just Leadership for Change, it is also how to strengthen your nursing association to be the most effective voice in your country. So yes, we are particularly targeted. We're dependent on some wonderful funding agencies. For the big project in Africa, it's Johnson & Johnson and the BD Foundation. Johnson & Johnson has been funding Leadership for Change in China. And so together we are spreading these advocacy courses at the grassroots level. Similarly, for those experienced high-level nurse leaders, the Global Nursing Leadership Institute, which some of you on the call may be an alumni of, is that best training ground, if you will, to really maximize your knowledge and skills and confidence to be able to be in touch with your leaders. I can tell you that when I visit different countries, I've had the privilege of meeting with health and finance ministers. I just recently met with the president of Taiwan territory. And so, there are opportunities to come together with our in-country leaders to be able to bring those messages. So it's important to look for opportunity, but also to figure out what is the skill building that you need and how else can we find it. And ICN is providing that in low and middle income countries.
Thank you so much. Francesco, do we have time for another question? Or
yeah, I think we could get to one more. This is again for Dr. Cipriano. They say, so you spoke to nurses as the hope for action and influence at the local level. What are some ways that nurses can exert this influence so that the voices of nurses are heard and nurses are seen?
Thanks. The most important thing is it doesn't matter what your title is. It doesn't matter whether you're trying to act at the global or country level, and because even at the local level, that might be where you can make the most change, where you have the relationships with lawmakers, with people who are influential, whether it's community leaders, whether it's employers. And so taking all of the tools that many of us have talked about, being able to articulate, why is it important to invest in the nursing workforce right now? Why is it important to have healthy and supportive work environments? Why is it important that nurses need to be paid fairly and we need to address gender inequality and all the issues that are important to honoring, respecting, and protecting nurses? You have the wherewithal and the knowledge and experience to go to those local leaders and start that discussion. So it's really advocacy at the grassroots level that is often the most successful. It may not be as flashy with your news media, but it is something that we truly encourage all nurses to consider advocacy as a fundamental part of their role, so that you're actually talking to people who can make change in your community and bring your colleagues around. You can be the initiator, bring your colleagues, and don't be afraid to speak to the powerful voices that can help you.
Thank you, Pam. Barbie, would you like to close our session? It's time to close. Barbie?
I just want to say what an honor it is to be with all of you. And now 58 years in nursing, I can't think of anything else I would have rather done with my life, and I'm still at it. Thank you, everybody. And thank you, dear colleagues, for joining us today.
Goodbye.
Yes, thank you very much to everyone here who spoke today and to
Thank
everyone
you.
who joined us in the audience. It was great having everybody here and a great first session. So thank you so much for everyone's work and for everyone taking the time to attend and ask questions.
Thank you very
Thank
much.
you.
Take care.
Thank you.
Thank you.
Bye.
Goodbye to all.
Thanks.